Due to the COVID-19 pandemic, healthcare workers have been experiencing high rates of burnout. Over 51% of healthcare workers reported burnout in a sample of 2,707 healthcare workers from 60 different countries. Well, what is burnout? Burnout is the prolonged stress and reduced interest and motivation of the job. Such factors that affect burnout include high workload, such as feeling pushed beyond a healthcare worker's limit of training, high job stress, such as making serious decisions without much time and the lack of time to adjust a patient's needs, poor support from the institution, and age. Younger healthcare workers are more likely to develop psychological stress. This could be because they're more likely to engage in activities that were restricted by the lockdown than older healthcare workers. A 2021 study by Al-Suleimani et al. Found that 36% out of 646 participants did not have psychological or mental health support from the workplace. Well, why not? Mental health is just as important as physical health. These are some strategies that healthcare workers can take to encourage positive mental health, such as practicing mindfulness, having premium pay, having your voice heard, having someone to talk to, and having organized meetings. In detail, we will discuss various methods of promoting positive mental health that healthcare workers can engage in. Specifically, we will focus on mindful meditation, premium pandemic pay, mental health, and daily meetings for updates and encouragement.
One solution we suggest is mindful meditation. As a healthcare worker, you're constantly working, stressed out, and tired. You're thinking about all your patients and you forget to give yourself a moment. So what does it mean to be mindful? Well, stop what you're doing, drop your phone, and just breathe. Being mindful is a type of meditation where you direct all your focus on being aware of the present moment and being aware of what you're sensing and feeling in the moment, allowing your mind to acknowledge every thought that is passing through your mind. Healthcare workers should be encouraged to practice mindfulness as it has proven to help with mental health. Research has shown how it affects people with depression, pain, smoking, and addiction, and mindfulness meditation has been found to significantly reduce relapse in people who have had previous episodes of major depression. There's no one correct way to practice mindfulness, but YouTube, books, online posts can teach you one of many ways to practice mindfulness.
Another possible solution that can assist our profession is through pandemic pay. The government provided frontline workers a temporary pandemic pay of $4 per hour additional to their regular wage from April 24, 2020 until August 13, 2020. Unfortunately, our profession was excluded from this even though medical radiation technologists, diagnostic medical sonographers, and radiation therapists have been risking their lives and their families to interact, image, and monitor COVID-19 infected patients. Withdrawal from the pandemic pay has not only brought to surface depression, exhaustion, and anxiety within their work environments, but has also impacted their lives as a whole. Inclusion into the pandemic pay eligibility can encourage these workers to continue working through the pandemic, as well as decrease physical and mental hardships associated with the job. Ultimately, covering MRTs, DMSs, and RTs under pandemic pay is a difficult but necessary solution and should be considered as a significant support mechanism going forward.
Let's talk about mental health.
Throughout this pandemic, mental health has become more of a challenge and a heavy aspect of our lives. The mental health of an individual is highly important and should always be a priority. As healthcare workers, we have had to greatly adjust to harsh challenges and adapt to new realities. It is crucial to take time for yourselves, talk to family, friends, exercise, and meditate to maintain good mental health. Furthermore, voicing your opinion and advocating for appropriate care and support in regards to mental health is essential in the workplace. Having social events maintains a positive atmosphere and distraction from stress. Social events also allows individuals to bond and encourage positive energy and support within the workplace. Socializing with others in general is known to boost one's mood and reduce risk of depression and anxiety.
Our last suggestion that can assist our profession throughout this pandemic is daily meetings with all staff for updates and encouragement. Daily meetings can offer many features that could likely improve the experience of workers in our profession during this pandemic. They can reduce stress and anxiety by creating an organized environment while updating staff on new protocols or procedures implemented due to the pandemic, as this is a time where common adjustments are required. Daily meetings can also increase productivity by motivating staff with encouragement, also reducing anxiety. They can go over what is on the agenda for the day and how these tasks will be accomplished, reducing chaos in the workplace and reducing stress of the employees. Daily meetings can be implemented by the supervisor of diagnostic imaging before each shift change for morning shift, afternoon shift, and night shift. It can be done in a small circular gathering to provide inclusivity and participation. Updates can be given with extra time for clarification or questions from the staff.
Thank you for listening to our strategies, and hopefully these can help and be considered to help our frontline workers during this hard time.